Hi there. Welcome and welcome back to everyone joining us on the Rooted to Thrive conversations that elevate our humanity podcast. It's your girl, Rochelle Peterson-Ansari, aka Professor P. Now, today we have Dr. Nirma Val- Vadlamudi. Did I do that right?
Yes, you did
All
great.
right. Excellent. I should have checked. I thought I knew something, right? So, um, our guest today is a mother, educator, and researcher who believes no one should die from preventable diseases. And I agree. And her research, man, she focuses on comparative effectiveness, safety, how much a disease harms a community, and economic evaluation to reduce vaccine preventable diseases. Now, Nirma, as I call her, was one of my students at Arcadia University. And yes, I said she was my student. um, I was a part of the village that she had with her at Arcadia University when she was an undergraduate. And Nirma, what I always remembered about her was that she was forthright, mission driven, and kind. It really made a difference. Nirma, thank you for agreeing to have this conversation today. How are you doing?
Thank you so much for having me. I am doing great. Thank you.
Excellent. Now, before we start our conversation about the
hmm
choice conundrum, the consequences of choosing to vaccinate or not, tell us a little bit about yourself.
Sure. So today I'm joining this conversation from Vancouver, Canada. I acknowledge respectfully that I'm joining from the lands of Musqueam people who has taken care of this land for millennia. And I'm very grateful for the amazing place that Vancouver is today and all the hard work people have done to maintain it. Um, so to get started, a little bit about myself. You did introduce me saying that I'm a mother, educator, and a researcher. I am all of those. I'm a mother of two children. One is 11, one is 4. So very much in the landscape of seeing a lot of diseases and how to prevent those in my children and their peers and the community at large. I draw a lot of inspiration from them and ask them questions of how they are and their peers are. In addition, I also chat with the people who have had their kids around the same time, whether they were my neighbors or community members. Um, I got interested in this line of research after a very careful consideration. And yes, I had the background in the health research and the training, so that kind of paved the pathway. And when my neighbor's grandson died from pneumonia, which was vaccine preventable, I saw that was imperative that I had to look into the journey of how no one's kid should die from vaccine preventable diseases. So that's how I got started in this area of research. Prior to that, I did my undergrad at Arcadia University, where I met you, and I came with lots of questions. I was always very curious about the world around me and the differences, how people were living or doing things, although I did not have the words for them. And I found the words that describe that um, racism, culturally doing things, or systemic discrimination. All of that I learned through different classes across the different um, sociology as well as psychology and biology. All of these different areas gave me the words that I know today, and it shapes the world I have tried to understand further. And after that, I went to work in clinical research industry for a little while before I honed down on which program I wanted to be part of further. So that's when I went into public health. So I did my public health master's at Drexel University in Pennsylvania. So I lived for a pretty long time in Pennsylvania, and I really enjoyed my time there. I've also lived for quite a long time in India and in Canada. So I feel like I have lived across three different countries and have experienced life in different ways that many people don't get to experience if they don't leave their local community and they're part of one community for a long time. So I've had the privilege of exploring different lives in different places, but also learned a lot along the way in terms of the words and how we can explain the world around us. So that brings me to the point where I was working in public health and I was understanding what information was shared with different people and where it was not consistently shared and how it impacted their choices in terms of whether they would take colorectal cancer screening or not. So that sort of shaped the way I view the world in terms of who has access to what information and is that sufficient to make the real choice, or is it a perceived choice where people may not have full information and hence they cannot fully decide for themselves and their family members. And sometimes it could be shaped by the economics. We may find that this is a service or a tool that we need for improving our health, but do we have the necessary money to access that? Or do we have the time to access that? Even if everything is covered, sometimes people have to decide between putting the food on their table or getting the services that they need to improve their health. So these are some of the questions that I have looked through my research during my PhD at UBC and my postdoctoral fellowship, where I've looked at if a vaccine program is available, who accesses it, how does it impact not only the people receiving the preventive tool, but also their community members at large. How does it impact the whole society in terms of if a child receives a vaccine and it saves their life, they will go on to live a long, healthy life and can contribute to the community and the society. But if we lose someone because they did not get the right preventive tool at the right time, which means that we will, as a society, lose on a amazing human being who could have lived a long life and contributed to the society. So there is that angle in terms of understanding when someone gets something, how does it impact them and the community at large?
Yeah, thank you for that. And you mentioned, and I'm so sorry for your neighbor who lost her grandson, who had a preventable disease, right? Something that could have been handled with vaccination. I was curious if you could, now that you've done so much work in this area, can you walk us through like a real examples of the ripple effects, health, financial, or even schooling related that occur when vaccination rates drop?
So that's an excellent question. When we went through COVID pandemic early
Mhm.
on, we did not know a lot about the COVID as a disease, and every day was a new day. We were learning all together as a society as well as scientists. Initially, we thought COVID does not affect children, so they don't need to be prioritized for vaccination. And then during the Omicron wave, we started to see that it was affecting children as well. And as it was affecting the community, you would see that all the children in the class are not there. They're at home recovering, which means that when a child is not prioritized for a vaccine or is not able to get the vaccine, they're going to get sick and they're going to be away from school for X period of time. Every kid is different. Some kids can recover within a few days, and some kids will take a long time. And it's not just that particular episode of illness that we are discussing. We are also discussing the long-term consequences. Some people go on to develop long-term complications from the acute infection, such as long COVID, or even death in certain instances, where people have to then deal with the long-term consequences of that particular acute illness, and that could be transported to any circumstance, whether it's COVID, whether it's influenza or pneumococcal disease.
Yeah, that's important. And I have to admit, I don't know if I should. You might be upset with me. There's one vaccine I've not ever taken, and it may be due to some misinformation, and that is common,
Hmm.
and I just won't do it. I'm just like, well, I never had it, and like I'm almost 58. So I'm like, I never had it. And I thought that the vaccine was a live culture, so you were actually giving it to the person. And the people who have had the disease, it's the flu vaccine. Um, they just seem like wiped out. And I'm like, I don't want that. Like, I don't want a vaccine that's going to make that happen to me for me to, be vaccinated from the disease in the future. And
Mm,
since I had never had it, I never prioritized getting it.
I totally understand that everybody's response
Mm-hmm.
is quite different. We are all unique individuals, and even when we look at five fingers on our hand, they are not same. They're all
Mm-hmm.
very different, and all the family members will have a different response to the same thing being given to them.
Mm-hmm.
So, how do we respond to the uniqueness of our body? So, with influenza, it's been around for over 100 years, and we have seen year on year people die from influenza when it is something that we can prevent. Yes, some people experience more side effects than others. Like I would get an influenza shot and it will hurt my um, spot where I got the vaccine for maybe a few hours, and that would be it. But in other cases, like my partner, he would need a day to rest. He would be very tired and would feel um, a lot of pain, muscular pain, because the body is generating an immune response and every person is unique. So he would need to plan to take it on a day when he can rest. Versus me, I can go about my day just fine. But it's just, I'm using the example of two people here. If you
Mm-hmm.
extrapolate that to the society, you may see a wide range. It could be somewhere in between where you don't have much response to a person where they might be down for a few days with body pain, fever. So, how do we understand our risk of how the side effects will look like? It's through vaccine counseling. I think scheduling an appointment with our healthcare provider to understand what are most common side effects and how we can mitigate those is really important so that we can actually make an informed choice that is my risk of long-term consequences from influenza higher than the few painful days following an infection, following a vaccine. So it's about understanding all the information that is out there to be provided to us in a way that we can understand and make a real choice instead of ignoring its importance. Because if we
Right.
completely ignore it,
Mm-hmm.
it's one way to move forward, but then we are not fully making an informed choice.
True. True. Okay. I hear you. I will make that phone call. I'll make that phone call. I appreciate you. I appreciate you a lot for this education. And as you mentioned, I'm not alone. So I'm curious, what do people often misunderstand about how one family's decision not to vaccinate can impact an entire community?
That's an excellent question. So it really depends on how many people have made that individual choice.
Okay.
So there is a concept of herd immunity that we try to understand and see. So if the whole population has no immunity against a particular disease, you start to see the natural thing like how people are dying or being hospitalized. But if you have a vaccine to prevent that, you want a specific proportion of that population to be immunized so that even if there are few people who cannot get immunized because they have conditions that prevent them from getting the vaccine, they are protected through the herd immunity. However, when a lot of people don't see the disease circulating in the population, they may choose not to vaccinate because they are not seeing the disease in circulating and they don't see how it can impact them and their family member. So when we start to make that choice, uh, at individual level and that individual level adds up to the community level, now we have more susceptible people than those who um, um, are needed at the threshold to prevent the spread of the disease. So that's where we don't know how an individual person's choice will add up and impact the whole community. Now, if you reach the threshold where like you cannot break the transmission and it's gonna affect a sizable population who has not been immunized, they're gonna miss school. The parents will have to miss work because kids they have to take care of the sick children, which means the businesses will shut down and it will impact our community altogether. And it's not so long ago that we have noticed that happening with the COVID pandemic. And it can very well come back for other kinds of diseases where we are now starting to see other diseases show up, like polio. We don't
No,
see polio circulating,
no,
but if a significant proportion of the population is not immunized against polio, it will start circulating again, which means that the kids will develop long-term disability, and then you have to figure out how to support the children and their needs. And then they grow up to be adults with disability. So there are the consequences right in front of us. Just because we have not seen our close friends and circle affected with polio does not mean it's not going to come back.
that's right. Okay, understood. And that, we are talking so far about choices, but there's also a level of misinformation out there too, right?
Hmm.
So, how does misinformation disproportionately affect communities with limited healthcare access?
That's a situation that we are trying to understand.
Okay.
So a lot of the information spreads through social media nowadays,
Hmm.
and it is heavily driven by who we are associated with. So in the communities where there is not enough healthcare, they may not have access to the right information from their physician or their pharmacist or their nurse practitioner, which means that they heavily rely on their circle of friends and family to share that information with them. And if they have received incorrect information or partial information or highlighting some factors more than others to really make an informed choice, then we are not helping our community fully. A piece of information can be viewed differently depending on how the community feels at that time point about that information. I would always ask people to take a brief pause and have that conversation with their healthcare practitioner. Ask them questions. Ask them as many questions as possible to understand how this can affect them. I know getting access to a clinician in rural areas can be a real challenge. However, pharmacies are everywhere. And pharmacies are most of the time embedded within the grocery stores. So even scheduling a chat with a pharmacist or doing a walk-in pharmacy appointment will get you more reliable information than what you're receiving from different circles, which is not necessarily trained to communicate on how a person's body's immune system works or how individualized sometimes the reactions can be, or what is the long-term benefit of preventing an infection is.
Okay. Yeah. That's powerful. I am so happy that I'm talking to you today because we're getting some real nuggets about like some real practical steps that we can take to help us get more information and to sift through misinformation as well. So now I wanted to go a little more macro, like a little larger, and look at national and state immunization policies. How do they either protect or endanger people with the fewest resources as well?
So, uh, usually different countries do different things.
Okay.
When a national policy is made for, let's say, incorporating a particular vaccine in their national infant immunization program, with that policy comes the dollar funding, which means that now they're going to use taxpayer dollars to ensure that that particular vaccine is available for that age group for free.
Mm,
Without that policy, it is not necessary, the funding is not available for people to be able to access the care. So that is the main piece that we need to understand with vaccine policies, that vaccine policies comes with the funding, not just the fact that it is approved or recommended, but it can look different at different countries. In India, where they would have a vaccine policy, they may rely heavily on other countries to see that what others are doing. But public health dollars may be not enough. So they may not include the policy for everybody. They may highlight some states versus other states will have to come up with the money by themselves, or they may just not include it, but they recommend it. Similar thing I've noticed in Canada as well, where we have vaccine approval. We have the NACI recommendation, which is the National Advisory Guideline, which says we recommend this, but the states will have to come up with the money to fund the program. So they may have to decide that. In the United States, it's been amazing where they come up with a national policy where they say that we recommend this and they have a funding attached with that so that states can implement that. But now, how the implementation rolls out at each state may vary quite a bit because they also have vaccine for children program and insurance companies at each state function quite differently. There is
mm,
no one consistent way where they cover for one thing versus the other. So even when it is recommended and funded at the national level, the numbers at the state level may be entirely different depending on how the state has formulated whether it's a mandatory or whether it's a rule-based program or it is something that is optional, which is basically depending on people to make that choice. So individual states have their own say in terms of how they want that program to look like in their state, which means that there may not be as many checks by their public health, by their clinician to ensure that is your child up to date on the vaccines that is recommended at the country level, or in general, it is good for that particular age group to have that vaccine to be taken so that they can be healthy and they can have a
mm.
long life to be able to go to school and be healthy and learn well.
This is interesting to me now because if I'm hearing you correctly, across all three countries that you mentioned, decisions are being made to allow people in different regions to have a say so about implementation, whether funding is available, how much is available is one thing, but even if you leave it, if you say, oh, a particular program is available to every American here in the United States, still at the state level, decisions can be made where there could be limited access.
In a way, in a way.
Okay.
Yeah, so if a state says we don't mandate vaccines,
Right.
Or if the state says we want to ensure vaccine mandates only for three out of the X number of vaccines that are available for
Mm-hmm.
children. So when a mandate is there, somebody is going to spend time to check. And then if somebody has not made that minimum that they need to have, they will be informed that you're missing so and so vaccine. You need to go and get it, or there will be facility ensured that they can get it. And when the mandate is there, which means the funding is provided or at least ensured by the government for that particular age group,
Mm-hmm.
as soon as mandates are removed, that is all for the goodwill of the government, which means that the public has to now advocate that even though we don't want mandate, we definitely want this service to be available for us for free. If not, now we are making the choice of whether we can afford that vaccine or not.
Mm-hmm.
And then it becomes the part of financial equity where, like, do we have enough resources to be able to prevent that disease for our family, for our community? So I'll give you an example of India's context.
Okay.
My child was born right around that time. Our chauffeur also had their kid. And the pneumococcal vaccine was very expensive. I was recommended, I got it, was 120 USD at that
Mm-hmm.
time. My chauffeur's salary was not as high that he could afford that for his child, but he was not even recommended that. Now, it's not part of the national program, so it was not free. People had to pay out of their pocket to get that vaccine. Now, first is, are you recommended? Second, are you able to afford it? Now, all of those things start to become a question when we remove mandates or when we don't have a free vaccine policy where people can access it in order to prevent those diseases and save their child's life. Luckily, my chauffeur's kid is fine, but now that's up to the luck that we are leaving. And not everybody is lucky to live through a severe bacterial infection in early childhood.
Goodness. Now, you were talking about in the Indian context, and I just want to say to our listeners, especially in the US, because I know you just heard Nirma say that her chauffeur, right? Like that means something here. That might mean something a little different here, right? So, um, the the point though is you had means to
I
get it,
had means
right? You had
and I
means.
had
Mhm.
know-how to look
Mhm.
at not only one country's information, but also compare it to others.
That's right.
So that's where the context lies.
Mhm.
Nowadays, we all have information at our fingertips. We can search Google, we can search Bing, we can search anything we want on our phone or on our computer, in the public library or at home.
Yes, we can. However, there are many things that are at our fingertips that we might not even think to look
Yes.
up in certain ways, right? I mean, I remember just something simple as, I mean, there really is all kinds of information at our fingertips. However, I'm of a generation that was here before we had that access, right? And so things that I would pick up the phone and ask somebody about, like even a recipe, I didn't, even though it was at my fingertips, I learned to ask for that information by making a phone call to a family member, right? And it's the same with, like, I want a doctor that's in my referral network, like people I trust. I'm not just going to go online and choose my primary care provider. I'm not going to do that ever. And especially not my dentist. right? Like I'm just certain things I'm not. So I think of the older generations, people older than me, are still living and thriving who are less likely to do that, right? And then there are many people, we have the phones in our hands, we have them. However, we don't use the tool the way a lot of people assume we would to get that information. They might think all of that information comes from my doctor. So I should, if the doctor didn't say anything, then I don't have anything to worry about, right? I mean, I think,
That is true. I want to highlight one piece about our conversations with our doctors is that the
mhm,
insurance companies have sort of regulated what kind of things can be discussed in one meeting. If you
mhm,
have more than one to two things to discuss, the insurance companies don't necessarily pay for that, which means you have to schedule a different time for that conversation. So if you went in with a headache and nasal congestion and a scratchy throat, so you're going there for your upper respiratory infection,
mhm,
feeling little down and all of this is affecting you, you go in to your clinician for that conversation and maybe you can discuss one more thing. Let's say you had back pain. So now you've discussed two things. um, Now, discussing about vaccine related questions may not even come up in that few minutes window. And if you had a question and you had brought it up, maybe they could say something. But if it is not something that was planned for, it will not come up. So
mhm,
even when we do end up meeting our healthcare providers, we don't end up having all the important questions that we want to get their insights on or their advice on. So scheduling a wellness visit is really critical in order to get all the information in terms of what should we be doing in order to stay healthy, what kind of things are available at our fingertips in our community, because there's a lot of things that public health does to ensure that everybody in the community has access to the right preventive tools as well as healthcare that they need. Now, how
mhm,
can we best use it? We have to schedule that wellness visit as regularly as possible, at least once a year. Have those conversations about vaccine related questions. If not, how to prevent a particular disease.
mhm,
I know
mhm,
it's definitely not something that was a part of the conversations a long time ago. Like if I tell my parents you should go schedule a wellness visit, they'll be like,
mhm.
"What is that? I'm not
Right.
sick.
I was,
Why do I need to go to doctor?"
right. I was getting ready to say, is that the same as the physical, the annual physical?
Yes, it can be part of that conversation. So, annual physical is when you go, they check. They can also have the conversation about what are the vaccines that you should be getting at that particular age. For example, if somebody turns 50 and you've
Mhm,
had your annual physical, you will get to know what are the vaccines that are now available because you've turned 50, or what kind of screenings you must get done to prevent some certain types of cancers. So,
mhm.
every age there is a particular kind of an information that is shared because your risk goes up for a certain disease.
Right. Okay. Yes. That is so important, folks. And I hope everybody is listening very carefully. And I didn't miss the point that you made a little earlier about now it feels like insurance companies are ruling the day of what happens in our visits with our doctors. Because you said, and I know I experienced this, that they can only talk to you about a couple of things in a visit before you actually have to schedule another visit or they don't get paid. And as we know, they have staff, they themselves have to be paid. It's a business that has to have income for it to serve us. So I get that, but something is going real. I don't know. This is concerning me because I did have an experience like that where I was going in for a physical, but something happened like a week before my physical. Am I not to talk about that? And interestingly enough, my doctor, who wasn't who I saw, okay, my doctor, I know never, ever said to me we couldn't talk about something, ever. But I had someone who was a new doctor, like they just got their little, their diploma, their degree, like their official. And they told me I had to come back. I was like, what is happening right now? And I needed to hear that too, because I really thought maybe that new doctor was being irresponsible. Because I'm like, I'm sitting here. I don't understand. We're doing nothing else. You're putting things into the computer. Why can't I ask you a question about this? Why can't you look? It just didn't make sense to me because the experience I had the week before felt life threatening,
Yes.
in the moment. And so I'm just like, we're not going to have my physical, which usually takes months and months and months to schedule, if I talk to you about this, you know? And that's what you're saying. Like if we go in and we're talking about the vaccinations, we might as well just schedule a visit to do that
Yes. Yes. All
because
your
times have
questions.
changed. Yeah.
Mhm. We have to schedule these conversations,
Mm,
whether it's an annual wellness visit, whether it's a physical exam, whether it's a discussion on
mhm.
um, particular screening or vaccination related questions.
Yes.
They are now really important to be scheduled for that particular reason so we can get
Mhm.
the few minutes that we can schedule that chat for.
Right. And now we have telehealth. I don't use it as much, but I know that some of the insurance that I've had in recent years, they offer like a telehealth option where we could get some of those questions answered there as well, right?
Mm-hmm.
So this
Yes,
is like a total other set of healthcare providers who can still answer your questions, but it might not be your primary doctor.
correct. Yes, so
Yes.
you can leverage telehealth time if
Mhm.
in case you're having tough time booking appointment with your primary care health provider. We
Mhm.
have a very few clinicians to serve a large community, and it's particularly challenging for people who live in rural areas where getting access to primary care's time can be very difficult. So we should definitely leverage telehealth to get some of these questions answered ahead of
That's
time.
that's great advice. Thank you. And I'm curious in communities where mandates are absent or there's some other limitation, what can individuals or schools, churches, nonprofit organizations, what can people in our communities do to help us increase access and increase our understanding?
So, what we have noticed with flu vaccines is that when during the flu season, we have everybody coming together and forming an umbrella of care so that nobody is missed. You have like community clinics, whether it's in the university or in school or at your um, church where people can come and get their shot so that it tries to reduce the access barrier that you don't have to commute to go somewhere to get that shot. It's also now easily available at pharmacies
Yes.
compared to earlier when you could only get shots at your primary care doctor. So
Mhm.
um, all of these different avenues has been explored for flu, and then also we have seen that helped us when we were going through tough time with COVID pandemic. Um,
Mhm.
Similarly, these things may help people set up the gaps of care. Right out of pandemic, when we were coming out, we noticed that people weren't getting their shots for other things that were part of their infant program because those appointments were not available. So there was some lag in people being able to access primary care doctor or public health offices. So they were getting those vaccines a little bit later. So
Mm,
sometimes people can go get things later when we are going through a tough time. But in general, we will have to come up with an umbrella of care when the mandates go away. We need to figure out how everybody can partner with each other to ensure that nobody falls through the crack of not knowing what vaccines to get, at what time point to get it, and how they need to prepare for some of the things that they need to get these vaccines for. So as of now, ACIP and CDC recommends certain kind of vaccines for infant immunization programs. Some states may be not requiring them for attending schools, which means that if children have not had those vaccines and parents are not aware about them, then parents have to do more work in finding out through discussions with their clinicians that what are the age appropriate vaccines and how they can get it to prevent these illnesses in their children. So regular checkups are really important. And if we look through the childhood visits, there is a lot of checkups that we have to take our little babies for. So every month there is a checkup in early infancy, and that is make sure that they have received the right vaccine, they are growing well. Sometimes we can also notice that those charts that the clinic uses to chart your growth can be quite different. You mentioned earlier that not all people are created equal, and that's something that I have experienced. I'm a South Asian, so I'm pretty small and petite, and so is my child. And those charts were made using European data of very tall people and their children. So, yes, my child was consistently below the 50% tile because they are small, but they were growing well, but they were below the 50th percentile every single visit. And sometimes that can feel like, what am I doing wrong as a parent? That could I be doing something to ensure that my child grows well? And that's a question that every parent goes through. So asking those questions is really important. And the clinician who checks your child every month will keep track of that and ensure that if the child is growing healthy and well and eating and uh, hitting all other milestones, maybe one or two things that do not meet the norm may be okay.
right.
But they have to be healthy to be able to grow. And sometimes preventing those vaccine preventable diseases is the only way for them to grow well and healthy. So ensuring having all these conversations at every visit is important. And if that's not covered at that visit, we should schedule another visit, whether it's telehealth or in person, to get the answers for the questions that we have, because
Mm,
every child is different, every person is different, and we may have to see how it best helps the child grow well.
wonderful. And thank you so much, Nirma. This has been such an informative conversation. I don't know if you have anything else to add before we go. Uh, yeah. If you have anything else to add, let us know. Otherwise, we're going to close out this conversation just on this conundrum that we have with all of the choices that we have around preventable diseases. One thing's for sure, I don't want to see people dying, and it could have been prevented.
Thank you so much for having me. And I think one of
Mhm.
the major thing that I have learned through all these years of raising my own kids and seeing my peers' kids grow, as well as the community kids grow, is that they all need that chance to live and grow. And by making an informed choice, we are giving them that chance to be healthy and grow well
Yeah. Well,
and
thank
help
you.
our community overall by
Yes.
preventing these diseases that can be prevented so it can help parents raise kids as well as a community to have healthy members in the community. And yes, sometimes side effects do happen, so having those conversations with our healthcare provider is important.
Yes.
And understanding and making that informed decision is really important when we know all that information coming
Yes.
from our trusted healthcare providers, not from
Hmm.
every place,
Right.
not when it
Not TikTok.
n- yes. So definitely reach out to your healthcare providers to get the right information.
Mhm. And I don't want to knock TikTok, but seriously, some people are going to TikTok for information, and it's about who you're listening to. That's my concern. You know, there's a lot out there now, even just about people self-diagnosing based on what they're hearing on social media. It's not just TikTok, but on social media. And I just feel like, yes, I understand. And sometimes, yes, our families, our neighbors have had some solutions that served us better than what we were told in our doctor's offices. But I have learned I need at least three sources to be consistent,
Hmm.
right? For me to make an informed decision. Three sources. I don't care where, but yeah, somebody with some credentials, please, when it comes to your health.
Yeah, not
And
from TikTok
right, right. But I'm
or
saying there
Facebook
are,
or WhatsApp.
right, but there's also people who are professionals with credentials on those platforms.
Hmm.
But oftentimes people are just listening to, just Johnny over there. They don't know who they're listening to, right? And begin to self diagnose. Lean I will lean and ask, what did my mother and family members do back in the day? Yes, because sometimes they didn't have access and they had a workaround that might have been healthier for us, at least us in the United States, right? And then I would ask a nurse practitioner, a doctor. uh, I leaned, well, MD, DO, it doesn't matter. And it also depends on what the issue is. If I'm leaning on a specialist, those are my top two that are consistent. The third really depends on what the issue is, right? Because it might be like another specialist to help me make informed decisions about my health. I'd,
I should also add pharmacist to that.
oh, yes, the pharmacist is in there too. I
Yes,
will ask the
pharmacists.
pharmacist questions.
Yes, they are trained.
Mhm,
They can answer questions about any meds, any vaccines, how it works in your body, what to expect, and
mhm,
how it helps. So their training is as extensive as
mhm.
nurse practitioners or clinicians in the area of their expertise, and that is to
Excellent.
help people. So I think we do have to remember that our families came a long way for us to be healthy, but they
Yes.
also lost a lot of people in the process.
Mhm,
So my great grandparents lost the whole family during influenza season
mhm,
versus later on, because different vaccines were available, we have been able to prevent some of these diseases.
mhm,
Like my dad's first cousin has polio, but no child in my generation has polio. So while we have lived through the natural remedies and it has helped us, and
mhm,
it is visible across the world. I think when we have a way to prevent some disease, we should look into that more seriously, ask questions about it, get our answers clear from the people who study that and can advise. Um, yes, people do have fear, and we have to recognize that everybody has a fear of needle in some way and form. And some people also have experienced some very rare side effects. So understanding that is also important. So no thing is without understanding it fully if we don't have the conversation with our healthcare provider.
That's right. Yes. And again, I'm going to say thank you, Nirma, for hanging out with me and the Rooted to Thrive tribe. Can you tell us how people can find you or, to ask questions, either at, the university? I would just say at the university. How can they reach you or in your social media?
Um, I can be reached at nvadlamudi@ufl.edu. My
Mhm.
email is public. I'm happy to help answer any questions that I have learned through my journey of research or personal experience. I would
Mhm.
highly encourage having conversation with your healthcare provider for more questions pertaining to your own health, because every
Mhm.
person is unique and
Right.
your healthcare provider knows more about you and will be able to guide you more clearly. But I can share the insights that I have learned through my research over a decade in pneumococcal work and RSV and flu. So please
Mhm.
let me know if there's anything that I can share from my research. Um, but at the same time, please do prioritize getting your annual visit with your clinician and ask those questions that you have with your healthcare provider.
Okay. Well, again, thank you, thank you, thank you. And Rooted to Thrive Tribe. Listen, today's conversation brings us back to a simple truth, and that is our individual choices don't happen in isolation. They ripple, they touch families and entire communities. So sometimes our vaccination decisions are decisions that are rooted in a matter of dignity, right? We know that there are many communities that lack access to clear information, trusted healthcare relationships, or reliable resources. Their choices or our choices when we're in those situations are shaped in fear, inequity, and sometimes and other harm, right? So when communities are left unprotected, those with the fewest advantages pay the highest price, right? So if we want to be anti-oppressive, culturally competent communities, we must talk about the choice in a way that lifts up all of our dignity and not divides us. And do, as Nirma said, do talk to your healthcare providers, pharmacists, and yes, don't forget who you were raised by culturally. They have information for you, but also just understand that you're in the backdrop of a larger society that has other information for you. And again, thank you so much, Nirma. This has been wonderful. I'm Rochelle Peterson-Ansari. Thank you for joining. Until next time, listen, folks, keep leading with compassion, keep learning with humility, and keep showing up for the collective good. Please share this episode, with everyone you know. And of course, as I ask you every time, subscribe. And next time, I'll be here to welcome you back to Rooted to Thrive.